This is a case of a 16-year-old patient with an instable OCD of the medial femoral condyle of his right knee, which was treated with bioresorbable compression screws. Here you see the arthroscopic view on the lesion. You see that there is a discontinuity, especially in the posterior parts of the lesion, while the cartilage is pretty good and intact in the anterior parts of the lesion. But probing with the palpation hook really reveals the instability. We did a mini open approach using a 2 centimeter arthrotomy. Here's the arthroscopic view on that lesion. So first step is to loosen the fragment just a little bit, leaving it in place on the anterior parts, on the very lateral parts, and do a sufficient debridement of the sclerosis of the subchondral bone. Additionally, we use some drilling using a 1.0 K-wire in order to perforate the sclerosis, in order to get some more biology and in order to improve the potential for healing. Afterwards, the lesion is inspected and reposition is performed before the refixation is performed. There are different options for refixation. In that case, we decided to use bioresorbable compression screws. This is a very modern implant, and one of the major benefits is that there's no implant removal necessary in the further clinical course. The application of the screws requires drilling as a first step. Afterwards, the screw is actually cut and inserted. It's a sort of a bioresorbable Herbert screw, which not only provides stability but also compression on the lesion, which is also really beneficial for healing. In order to achieve a good rotational stability, we generally use 2 screws. The diameter of that screws or the dimension is 2 millimeters times 26 millimeters. Rehabilitation contains free range of motion and limited weight bearing for a period of 6 weeks after the surgery.